Thank you, Diane. I'm delighted to be here and honored to be here. It's such a great tradition you have going for International Grant Professionals Day. My name is Ellen Gugel, and thank you for allowing me to share one of my favorite grants topics here, measuring outcomes. My name is Ellen Gugel. I'm an independent grants consultant. I've been doing this for over 20 years, mainly here in New England with community-based nonprofits. Place-based, community-based nonprofits in all sectors. So I've been doing a lot of private grants, corporate grants, some state grants. Here's what I hope you'll take away today. First off, this is going to address GPC competency number 3, program design and development. And this always requires working with program staff, which we're going to talk a lot about how to do today and how to do that effectively. So I hope that you're going to get out of this that you can elicit outcomes measurements from program staff, partner with them to determine what they should be collecting and what they can easily do without causing them too much fatigue or time. And I'm going to show you a framework for guiding that discussion with the program staff. And I hope that you gain confidence and new ideas for answering this question. You've seen the question before. It's asked in all different kind of ways. Measuring success. What's the program impact? What data do you collect? How do you use it? It's all getting at the same thing. So just a brief example of outputs versus outcomes. Now, I know that as grant professionals, we pretty much know the difference between outputs and outcomes, but program staff doesn't always. But the outputs are what you're funded to do, the activities that they're paying you to do, educate a certain number of students, reach a certain number of neighbors with information, whatever it is. But the funders really want to know what difference you're making, and the outcomes prove that you did, what changed as a result of your program. This can be observable, measurable change in awareness, access, knowledge, behavior, and a whole host of different things. Obviously, you're not going to measure all of these, but these are ideas for what you can measure. So I like this slide. Not how many worms the bird feeds its young, but how well the fledgling flies. And I think this second example is even more interesting. An output is the number of patients discharged from the state mental hospital. The percentage of those capable of living independently is the outcome. But there's something in between here. How do you measure that? And I would say the first thing I'd think of is rehospitalizations. That's not in here, but that's what we want to be measuring, that type of thing to prove outcomes. Big scary screen, possibly, but I like this. It comes from the University of Wisconsin Extension program. I stumbled on it about 10, 15 years ago, and I've been using it ever since because it's a long laundry list of ideas for that you can say, does this apply to this program? Does this apply? What are we really trying to measure? Short term, it should be measurable, so you're going to have data for it. Long term is more about trends. You may be able to show long-term impact, long-term outcomes if your program's been going for a while. The example I like is smoking. Lots of anti-smoking campaigns all over the country, and now in the US we have the lowest smoking rate we've had ever. So long-term conditions changed as a result of anti-smoking campaigns. Obviously they didn't know that when they first started. So choosing metrics. First off, when I talk with program staff or leadership, I want to choose metrics they're already collecting and see if I can contextualize them to fit what the grant maker at hand is looking for. I would also say limit metrics. Just a few measurable, observable changes is what you want to measure. Don't overdo it. Don't overcomplicate it. These are often reflected or expressed as a percentage or number. What number and percentage of clients or participants demonstrated the change in access awareness attitudes, whatever you're measuring. And then review that data on a regular basis so you can communicate the results, and also to inform program improvement. How would you adapt based on what you're seeing, and to identify trends long-term or medium-term. Now, we all know, if we've been in this field for a few years or more, that working with program staff can pose a challenge. They're busy, they don't want to be bothered, and they may have difficulty articulating accomplishments and what they're trying to achieve. They're good at what they're doing. They know their stuff, but they may not understand why this question is being asked or how it relates to what they're doing. Yet they're the ones in the best position to know what success looks like, and that's what we need to get out of them. Often they are collecting data, but don't recognize its value or how it relates to the question at hand. It's second nature to them. They may overlook the role of what they are collecting and the value. Particularly if they're government funding, they are collecting some data that you can use. And often there's no need to create new processes or metrics. So how do you get that out of them? Do you survey them, email them, call them, interview them? I've had the best success by setting up an appointment with them to fit into their calendar, to talk with them one-on-one, either face-to-face, Zoom, phone call, however it's best for all of you. They're very often willing to put aside that time to talk about their program because they love their program, but they don't want an answer in email. They hired us to do the writing. They don't want to have to write anything. Obviously, they're going to have to get you some numbers. So there's a little bit more to it than that. We survey students before and after field trip to see what they've learned, what they liked, what we could improve. This is the education director and her surveys, and I get the numbers from her. It documents changes in knowledge. That's one example. I've got some more. Requests from other organizations to collaborate have doubled in the last few years, 2 years. This demonstrates an increase in community awareness and proves the value of the school to the community. In the last 7 years, we've had 0 repeat pregnancies among residents. This was program staff at a transitional housing program for teen mothers. So they have documented changes in behavior. A couple more examples. Even during the recession from 2008 to 2010, 87% or more of refugees got jobs within 30 days of arrival. This is a resettlement, a refugee resettlement program, and they track this through their case management records and compiled results monthly. This shows improving economic condition for the family, and you can argue for the community. Our goal is to provide access and inclusion for an ethnically, economically diverse student body. The financial aid program ensures 15% of students are low and moderate income, and 50% represent a racial or ethnic minority. This is a community music school. This compiled data is already captured as part of the enrollment or intake process, so it's a baseline to measure access for underrepresented populations and how they can improve on that year upon year. Some examples of how we can measure outcomes, and this is another list that you can, just brainstorm with program staff. It's surveys of what they learned, what they retained, behavioral intent, whatever. Surveys, we rely on surveys a lot. Percentage of clients against the community benchmark. Teen birth rate among the population that you're serving compared to community or statewide average if you're in a teen pregnancy program, a teen pregnancy reduction program. Percentage of clients who succeed at what the program's designed to do. Did they move to the next level of ESOL? How many of, or what percentage retention rate, semester completion, fewer classes, patches. There may be tons of data out there that you've never thought of as being able to be applied to this program to prove that it's doing what you said it's going to do. And then no data without stories, no stories without data, as one program officer from Ford Foundation told us. Testimonials, success stories, clients writing their own words, awards and recognition for your organization or your leadership. How about a quote from a city official like the mayor who says, "You're the greatest"? And then I love programs of photos of programs in action, happy children at summer camp. One last thing, just to confuse you, can an output be an outcome? And this is where we come in as grant professionals. It depends on your organization. For example, an increase in a number of volunteers may not be an outcome for a social service agency, but it may very well be an outcome for an advocacy organization where you've got volunteers who now have are going door to door, or they're writing letters. It proves an increase in awareness and attitude, or both. And I want to thank you all for listening to me on one of my favorite topics. And thank you again so much, Diane and Megan, for facilitating this and making it possible.